This week, Fauci said we have to wait until 75 to 80% of Americans get the corona vaccine before we can end the lockdowns. But that would take months, keeping the lockdowns going through the spring of next year, maybe even the start of summer. This is quickly becoming the establishment's vaccine groupthink, repeated as gospel, as if there are no other options. But there is an alternative, and joining me now to explain is Stanford University Professor of Medicine and co-author of the Great Barrington Declaration, Dr. Bhattacharya. Great to see you. First of all, thank you so much for all your work on this. The Great Barrington Declaration was such an important step in challenging the groupthink we've seen so far on how to handle the virus. What's really interesting is how that connects with what's coming down the line now in terms of the vaccine. I'd love you to put those two things together and explain what you think needs to be done.
Sure. So the vaccine is a golden opportunity to end the epidemic if we just do the right thing and use it correctly. We know that the elderly are the most vulnerable people. There are about 50 million elderly people in the U.S. It just so happens that within the next 2 months, we will have enough to vaccinate about 50 million people, enough vaccine. See, if we vaccinate those folks, and that's basically the idea of the Great Barrington Declaration, the focused protection of the elderly and other people who are vulnerable. Well, the rest of the population, the lockdown harms are far worse. Our schools are closed, basically really damaging our children. Young adults, 1 in 4 seriously considered suicide this June. The lockdowns are far worse than COVID infection. So ending the lockdown is a huge priority for the younger, non-vulnerable, and for the older people who are actually vulnerable to COVID disease. Well, we can use the vaccine to end that threat in 2 months. So vaccinate the elderly, end the lockdown in 2 months when that's done.
So what do you make of it when you hear? I mean, it's, as I said, it's become what you hear this everywhere now, that actually you can't relax the restrictions until a far greater number, not the kind of numbers you're talking about, just the most vulnerable, the elderly, but pretty much everyone has been vaccinated. Only then can we lift the restrictions. What do you make of that?
I mean, I think it reflects an absolute blindness to the harms of the lockdown. The folks like Dr. Fauci seem to think that the lockdowns are a costless intervention that harms nobody, whereas COVID-19 is this absolutely deadly thing. Now, for older people, it absolutely is deadly. That's why the vaccine is such a great tool. We can protect them without any controversy. We can protect them. I think even the CDC has recognized that they should get priority. On the other hand, for younger people, the lockdowns are so harmful, so deadly. There's really no good justification, given the harms of the lockdown for the non-vulnerable population, that people without severe chronic disease under the age of say 70. Why wait?
It's such a different. What you're setting out there is a real departure from everything we're hearing. I mean, it makes total sense to me. As you say, it's an absolutely clear example of the focused protection that you've been arguing for from the beginning, including on our show earlier in the year. I just want to ask you about the prioritization. There's another thing we are hearing over and over again, which is that in terms of the vaccine that we have available right now, yes, there's talk of giving it to people in nursing homes. That would definitely be part of the kind of population you're talking about in terms of vulnerability. But also you hear teachers, healthcare workers, essential workers, that kind of. Does that make sense to you in terms of where we should prioritize in the 2 months ahead of us?
I think for some of them, maybe. So like if you're a 63-year-old diabetic and you're a teacher, then absolutely you should be prioritized. You're in the high risk. I think we should prioritize based on medical risk, not simply on what your work location is. I think that's the mistake. So thinking about, I mean, I'm not against vaccinating teachers that are vulnerable. I mean, again, the key idea is we want to minimize the mortality from this disease. How do we do that? We find the people who are most likely to die if they get infected, and then give the vaccine to them. Rather than saying, only teachers should be vaccinated or only, actually, there's another class of workers I do think should get priority for vaccination is people who care for the elderly in nursing home settings or home health settings. There, again, the idea is protecting the vulnerable. Minimize mortality, use the vaccine to minimize mortality in the short run, and then end the lockdown. Don't let politics get in the way.
I'm just closing thought. How do we persuade the establishment, the medical establishment of this? It seems to be so different from the way they're approaching it.
I think once a sufficient fraction of the older population and other vulnerable are inoculated, and that'll happen, by the end of January, it'll happen. It will be very difficult to maintain the lockdowns. I saw Bill Gates on TV, I think, saying that we should have restaurants closed for the next 6 months.
Oh.
Are people really going to want that when, my mom, 80-year-old mom, is not actually at risk anymore because she's inoculated? I think it's really unlikely that the political will to maintain the lockdowns will survive the vaccination of the vulnerable population. At least that's my hope.
Well, thank you so much for speaking out at this stage where we still have the ability to influence it. We'll follow it. I'm sure we'll want to talk to you about it in the weeks and months ahead. And just thanks for everything. You're such an important voice in this, and we really appreciate it. Thank you.